whatever is your particular condition. Secondly, they need relevant data, and they need that data assembled from all of the different places where your health data is today. It's anybody that's got any connection with the healthcare system, the chances are your data is scattered across hell's half acre, in labs and pharmacies and doctors' offices all over the place. So we're trying to bring it together for you. But more importantly, and sort of relevant to the topic today, people also want a trustworthy place to put that information. And I use the trust it's got a broader word than just is it secure technically, and is it private as a result of that. But also, why is this company or this organization collecting my data? What are they doing with it? What are they allowed to do with it? And so on and so forth. So a big part of what we've built Dossia around is the fact that we're building the entity up as something that's independent from your relationship with your employer. This is not your employer holding your data. It's not held by the health plan. It's not held by the hospital. It's held by you. You can decide where your data goes and so on and so forth. So that whole granular control of who sees my data is really intrinsic to the whole mission of what we're doing. And obviously, if we had any kind of breaches of the type that John related, we'd probably be out of business in a heartbeat. So, huge amount of effort, we're putting in to make sure those kind of idiot things don't happen. One final comment, a lot of people talk about personalized medicine as being something that's the next wave of evolution of healthcare. By personalized medicine, they mean decoding the genome and tailoring drugs and so forth. But for me, personalized medicine is putting the person into medicine, having you, the person, take charge of what you're doing and get more involved. It's not about DNA; it's about data. It's not just about the data that your doctor gives you. It's about how you feel. Are you taking your pills? What's your exercise program doing? A lot of that between the doctor visit stuff. So, what we're trying to do is create a personalized medicine launch pad, to launch wellness tools and launch real solutions for people's healthcare that will lower cost. I'm sure John's got a bunch of bear trap questions that go out as relative to privacy later on.
All right, thanks. I'm sort of, as a last-minute replacement, I just kind of cover a little bit about what we wanted to talk about from the Continua Health Alliance perspective. From a Continua perspective, working with devices and putting those in the home, obviously we have to make sure that information is going to be traveling over secure channels. So we've engineered from the ground up on our certification guidelines the privacy and requirements for security along that data as well, so that it only can work with single individuals and have the ability to specifically address down to the specific serial number of a specific device. So we inherently have, as part of Continua, taken a look at that. Now, just from a historical perspective, before I came to Continua, I did a lot of work in the EHR field as well. Was served for 2 years on the CCHIT, the Centers for Certification for Healthcare IT, Privacy and Compliance Oversight Committee that actually set the standards for EHRs as well. And so there are some things that we still have to focus on here, and from an electronic health records perspective, and that is, why do we see this data as valuable? Why is it that people want to steal it? It's not something that we're seeing as an issue in other countries. It's not, when you go to the European countries, it's not something that they're focused on. And it's an underlying issue here that we have to take a look at from a socioeconomic activity, is what makes this data valuable to somebody to steal in the first place. Second component of that is, how do we necessarily address the right types of security? Ultimately, the most secure data is data that you can't transfer at all. Well, unfortunately, in order for us to deliver healthcare, we have to have that information go from point A to point B at some point, and we have to create the right trusted partnerships. So it really becomes a matter of, what HIPAA was trying to address is establishing that chain of trust that the data is being taken care of effectively. The second level of that, though, is the need to know, and when do we actually need to know the right types of information about a patient to make the medical decisions that we need to for their care individually. And that's one of the things that we worked on and struggled significantly within CCHIT and also at the National Governors Alliance, is who should have the right to have access, and when do you need to have that access from that perspective. And establishing those types of criteria is something that we work through, and so there's basically 4 levels of access. You have anybody and everybody who can have access to the business information side. That in essence, provided you sign the right documentation that you have the right need to know for that information. This is like transactional information saying that I need to pay this bill relative to what took place. Then there's clinical information that you start to get into specific levels, with varying levels First, nurses had access to it. Second, doctors had access to it. And the fourth level, really the highest level, was that which was considered private information. So in things like psychological information, I'm taking Zoloft for a particular mental condition. So you wanted to make sure that that information was even locked away only to certain qualified individuals. So it became very difficult to, in essence, segment that. So it's a matter of how do you segment the information to lock it appropriately as well. The issue ultimately, though, goes back to this whole thing. We never knew how unsecure paper was. You could make a copy of paper today, and nobody ever had any documentation of that. What we're seeing today is sort of a new artifact to the whole systems, and the fact now we can actually trace it. We now know that something has occurred, as opposed to the older systems where you could take copies of paper out and never have that episode ever recovered or known about. So, I think that it's actually highlighting the ability of our security systems to actually catch and do what they're supposed to do. In the sense now that we know about where these breaches are occurring. With that said, I think that there are security and implementation capabilities that we are implementing. The systems inherently have the security now and are starting to go through the certification process to acquire that at least from an electronic health records perspective, as well as from the device perspective from the continuous side.
Hi, I'm Annalisa Silvestre from Kaiser Permanente. For those of you that may not be aware, Kaiser Permanente is the U.S. Largest not-for-profit healthcare organization. We are one of those organizations that has a hospital, health plan, and provider groups integrated into one system. We have about 8.5 million members across 10 states. We're primarily based in California, but we have a presence in Georgia, Hawaii, Northwest region, Mid-Atlantic states, and Georgia. We have been the leader in online health care records for consumers based on the adoption rate that we've had within our system. We were able to put up Epic's capability for our patients. So we have over 3.5 million of our members who have activated an account and have gone on and used one part of their personal health record or done some kind of transaction in our system. So over a 10-year period, we've got considerable experience in looking at the issues of security and privacy and what it is that consumers will actually do or not do with online services. One of the things that has made us a little bit different is that we've been able to, as Colin referred to earlier, because we're hooked into the electronic health record, we're able to display the same information to our members that the doctor can see. So that becomes very valuable because it's real clinical data. So you can get your test result, you can go into a lab in the morning at Kaiser and in that afternoon often see those test results online. You can use it, you can view it pretty well on a mobile device as well. So that becomes very handy for people in a world where the record was never available to people at all. And most of you in this audience, I can tell by looking at age, didn't grow up with any kind of electronic access to anything electronically because there were no computers. So imagine today the amount of information that is being made available to consumers about their health. And I think we're all learning a lot about what that takes to keep secure. We've noticed that security and privacy is not a barrier to using online health services. Our belief is that people assume security and privacy is there. When you breach that trust by having things stolen or systems that collide in a way where information is spilled and given to people that were not intended to see that data, that erodes the trust. But it's not enough of a barrier for people to go on and sign up and use those services because it's of such value to people, for all of us, to have access to your data. It's such a basic capability, you kind of wonder why we didn't have it years earlier. So everything from a mom who wants to look up immunization records for her kid so you can fill out that stupid camp form to the situation I'm in where I'm able to go online on behalf of my parent and look at all of her visit record, her immunizations, her medications. It becomes a very valuable, very valuable part of people's lives. So what we do around security and privacy is we have it as a continuous effort. You're never done. You're always looking at the systems that you've built to understand where their vulnerabilities might be. And you have, in good systems, you have a whole process in place to look very closely and assess risk and continue to make investments to keep things safe and to make sure that things are private. we've noticed a number of people in our system